Hi everyone, I hope you're all keeping well. I wanted to firstly say a big thank you to those of you who were able to join us at our second live intermediary event a couple of weeks ago. At that webinar we were joined by Dr. Luke James of Bupa, our Chief Medical Officer, and also by Louise Aston, who's the Wellbeing Director at Business in the Community. At that COVID-19 update, we explored how the biggest health crisis in our generation is taking not just a physical impact on employees, but how it's affecting their mental health. We also discussed the implications for businesses and how they must rethink their practices for the short and the long term. I thought it was another tremendous event, and we were really pleased to see so many of our intermediary partners join us once again. The recording of it, if you weren't able to make it on the day, is available on our intermediary newsroom, so please do take a look. Like the first event, we had a number of questions where we just didn't have time to answer everything, and so I wanted to follow up today by giving you some answers to the questions that we didn't get to on the day. With that in mind, I have two people joining me. Firstly, Dr. Luke has asked one of his colleagues, Dr. Arun, to deputise for him in answering the medical questions, and secondly, James Sherwood is also here to answer the remaining questions. So without further ado, let me pass you over to Arun and to James.
Bupa Health Clinics will soon be launching our COVID-19 antigen testing proposition. We're really proud to be offering this because it will allow our customers and clients to use this as part of their return to work strategies for their staff. Our offering will use antigen test assays that have been approved by Public Health England, and we'll be offering additional services for our customers once they've had the test. Antigen testing is the crux of testing at risk individuals, as we do not currently know if antibody testing confers immunity to COVID-19. We're also closely looking at the COVID-19 antibody test and plan to have this launch very soon, although we're sure that this will only at the moment say whether someone has had COVID-19 and not whether it confers immunity. Both of our offerings will be Public Health England and MHRA approved, ensuring the safety to our customers and the accuracy of results, as both of these are paramount to us. In addition, we'll be offering layered services that complement the testing pathways, such as temperature screening, thereby ensuring multiple layers and levels of safeguarding employed workforces.
Providers are introducing new protocols to mitigate the risk of exposure to COVID-19 when accessing care. Clinical guidelines are still evolving with growing clarity over how they should work for a patient admitted to hospital. Currently, the guidelines indicate that patients should be self-isolating for 14 days prior to admission, should be tested 2 days prior to admission, and have a verbal risk assessment on day of admission. In addition, hospitals are starting to test staff and introduce other measures to ensure that their facilities are safe. This is a critical risk control measure for admitted patients. There is now growing evidence of heightened post-surgery mortality for patients with COVID. Risks for outpatient tests and consultations are much lower. Therefore, clinical guidelines do not currently require testing prior to these appointments. Customers should expect some measures, such as a verbal risk assessment prior to their appointment, temperature checks, social distancing measures in clinics, enhanced PPE by staff, but the guidelines do not currently require testing prior to outpatient appointments. We've confirmed that COVID-19 tests performed pre-admission will be covered. It should be noted that COVID-19 tests for other purposes such as general screening or return to office requirements won't be covered under our policies. Ensuring our customers have access to safe, high-quality care is one of our top priorities, so we are working closely with providers to ensure the appropriate measures and standards are put in place. One final point, these services aren't covered by our contracts with providers, so customers shouldn't expect any charges directly from providers for them. I understand that delays in accessing care must be worrying and frustrating for customers. The customer's consultant or the facility which their test or procedure is booked are best placed to help with rescheduling any delayed appointments. We do have a range of services that can help in the meantime. These include, for example, prehab, pain management, self-help physio, emotional support. These are, customers can find information about these on the COVID-19 hub or by contacting our customer support team. We can also share our understanding of which services are available in other areas and other regions if customers want to consider other options. If the test or procedure has been pre-authorised already, then there's no need to re-pre-authorise that appointment once a new date has been set. The longer run health implications of COVID-19 are still not entirely clear. However, a range of follow-on health concerns are possible. For example, impaired lung function, kidney stress or failure, and for patients that have been in ICU for prolonged periods, muscle loss. So for existing customers, these follow-on health implications would be covered in line with the terms of our policy and the customer's products. For new customers that are suffering these health impairments, whether they're related to COVID-19 or have been triggered for any other reason, they would be considered pre-existing conditions. Under the contract with the NHS, hospitals have only been able to provide a defined range of services, and until now have been focusing on treating only the most urgent cases. These guidelines are currently in the process of being updated to open up the system for more patients. There is some regional variation in how this is happening, but overall the national picture is that hospitals should shortly be able to provide level 3 services. So that is any procedure or treatment that is required within 3 months of that initial consultation. NHS England and the Independent Hospital Network have provided guidance documents on the national position, and these are your account manager should make these available to you if you wish. The specific position in each region is less well documented, but you can get advice on that by contacting us directly. The NHS England and the independent hospitals are in discussion about a phase 2 contract. The purpose of this contract is to help tackle the NHS waiting lists that are estimated to have doubled over the past 4 months. We understand that if it's agreed, the phase 2 contract would likely be starting at the beginning of September, and we're therefore now anticipating that the current contract will likely be extended until that date. It's important to note that the independent hospitals and the insurers working through the ABI are pushing hard for any phase 2 contract to allow the prioritisation of private patients, and that requirement is also introduced into the current contract if it is extended. This would allow hospitals to open up all services to private patients while still supporting the NHS with the spare capacity that is available. We understand that discussions with the NHS are about to be concluded, and we hope to have more concrete information on the terms of the extension and the phase 2 contract imminently.
Well, thank you, Arun, and thank you, James, and I hope that everybody found that useful. At our next event on the COVID-19 series, we're going to discuss the next phase of lockdown easing in the UK, and our Bupa experts will share clinical insights and lessons from the global markets where Bupa operates, including China, Hong Kong, Switzerland and Spain. That event is on the 5th of June, Friday at 11 AM, and it would be great to see you and as many of your colleagues there as possible. So please put it in your diaries and we'll see you soon. Cheers.